dissection of the pectoral region, you could able to identify the main things are you have to remove the skin, you identify the superficial fascia which is going to fill with the fat, and the shiny membrane is called as what? Pectoral fascia or deep fascia. And very immediately you identify the pectoralis major muscle which is going to have the clavicular head and the sternocostal head. Both forms a bilaminar flattened tendon and they inserts into the lateral lip of the intertubercular sulcus. Is about the origin and the insertion of the pectoralis major, and medial and lateral pectoral nerves are going to supply. So now this image helps you to remember the pectoralis major of clavicular head and the sternocostal head. This is another view where you could able to identify the clavicular head and the sternocostal head with the insertion of the pectoralis major muscle. And once we have removed the pectoralis major muscle from third, fourth, fifth rib, the pectoralis minor originates and inserts into the tip of the coracoid process, which is supplied by the medial and lateral pectoral nerves. So this muscle is called as the pectoralis minor muscle, where you could able to identify. So the pectoralis major, pectoralis minor, and from the first rib to the middle of the clavicle, you could able to identify a smaller muscle that is called as the subclavius muscle, which is supplied by now to subclavius muscle. So the three main muscles where we could able to identify major, minor, subclavius. Another view in final closure we have is a skin with the superficial fascia and the shiny deep fascia. Then remove the pectoralis major, pectoralis minor, subclavius. Below the pectoralis minor, you could able to identify the vessels in the axilla, that is axillary artery, axillary vein, and the brachial plexus to be remembered. So this is a little short dissection where you could able to remember for the pectoral region.